All right, it is Women's History Month, and we are focusing on our health for today's checklist. So we brought in NBC medical contributor Dr. Narula to walk us through some of the most important numbers women need to know. Good morning to you.
Good morning.
These are things that I think sometimes we take for granted, but then if I put us to the test and I said, okay, do you know this number, that number, we wouldn't know our numbers.
I know, it's so important.
All right, so let's start with, this can be intimidating for a lot of people, blood pressure.
Yes.
What do we need to know?
One of my favorite topics, I'll probably talk about this 100 times today, but yes, blood pressure, one of the leading causes of heart attack, stroke, heart failure. So important to know this number. So 120/80 is normal. Once you go above 120, it's actually considered elevated. And once you cross 130 for that top number, that's high blood pressure. Once you cross 80 for the bottom number, high blood pressure. You should start getting your blood pressure checked in your 20s. Certainly
in your 20s?
In your 20s, yes.
And what are the implications, let's say, for 5-6 years it goes unchecked, or a decade, which it can?
So it's a problem. I like to tell my patients it really damages the blood vessels all throughout the body. You can imagine every heartbeat, those vessels are seeing elevated pressure, and that's how early heart disease or plaque forms in those arteries.
Okay.
Can also lead to aneurysm. So really important to remember that number.
All right, this next one here, you're a cardiologist, so
Yes.
heart health is a must. Let's talk about the main numbers we need to focus on for cholesterol.
Right. So anytime you get your cholesterol checked, you're going to see 4 numbers: total cholesterol, HDL, LDL, and triglycerides. In general, we want the total cholesterol to be less than 200, and the LDL, this is the bad one, should ideally be less than 100. Now, there's obviously things that raise it. It can be genetically high. Also, it can be related to diet. So we usually tell our patients to lower the saturated fat in their diet to help lower that LDL.
Can you diet your way to a lower number?
You can.
Not diet meaning like, you know what I mean, but like through food.
So usually if you change your diet, you'll lower your LDL by about 5 to 10%. But a lot of people do need medications.
Okay.
They hate that dreaded word statins, but they are very beneficial for those who need them.
Okay, you'd rather have it taken care of, though, than
Absolutely.
the other thing. Okay.
Yes.
Okay, let's talk now about blood sugar. What is the A1C test for?
So this is a test that basically measures how well your blood sugar has been controlled over the past 3 months. So it's a nice marker of really how you've been eating over time. And so the A1C should be less than 5.7. Once you're 5.7 to 6.4, that's considered pre-diabetes. And then once you go over the 6.5, that's diabetes. So a lot of people don't pay attention to this pre-diabetes phase, but this is really important.
You're going in the wrong direction.
Exactly. And so it's really a measure in general of how much carbohydrates you're eating. So bread, sugar, pasta, anything with carbs, you want to try to cut back on.
Is this a typical blood test during, an annual
That's a great question.
appointment?
Not always. Lots of times doctors will just do a blood sugar or glucose test and not do the A1C. I actually check this in all my patients.
Okay.
Yeah.
Next, it's so important, our weight, especially BMI.
Absolutely. So another marker of potential risk. So BMI is the measure of your height-weight ratio. So normal is going to be this 18.5 to 25 range. Once you're 25 to 30, that's overweight. And once you're above 30, that's obese. We know that obesity obviously comes with a whole host of potential complications down the road, including cardiovascular disease, joint problems, sleep apnea, certain types of cancer. So really important to know this.
And that you could just do.
You can go online and just
There's
Google
calculators all
BMI
over.
calculator. Exactly.
Yes.
And get a
Awesome.
sense. Yep.
Doctor, let's talk about the thyroid hormone, okay? It's not something we normally think of, but this is a big one when it comes to metabolism.
It is. And so many times I see patients who have never had this checked or haven't had checked in a long time. And this is another one that I check yearly because the thyroid really regulates a lot of things. And if it's off, it can be associated with things like high blood pressure, abnormal cholesterol. It can make you feel fatigued or have hair loss if it's low, or if it's high, even palpitation. So it really controls a lot of our functions. And it's important to have that
And
checked.
start checking it as early as 21.
You can start checking it, and this is sort of the general range, 0.3 to 4.2.
Okay. Okay. And then what about cancer screenings, right? As we get older, I can't keep track of all the dates and the years. Walk me through this.
Yes, I know. It's important to remember these. There's obviously many cancers, but these are the 3 that we're going to talk about that tend to focus on with women. The first is cervical cancer. So starting at age 25, that's when you should really be thinking about your pap smears. Another important one, mammograms. So we know that women can have the option or choice to start getting mammograms as early as 40. Absolutely, by the time they're 45, they should be getting them each year. And then after 55, every 2 years. And last but not least, colon cancer. A lot of people don't like to think about screening for colon cancer, but it's so simple. It's so important. Starting at age 45, women should really be getting screened for colon
And maybe
cancer.
even younger if you have a family history?
And even younger if you have a family history, absolutely.
So good. I have Dylan's question. So you just go to your doctor for your annual checkup, and you just say, hey, I need all of these things.
You
and then
should.
You just get it
You
out.
say, Dr. Narula told us.
Exactly.
Yeah,
I'm sure they'll love that. but yes.
Seriously, do that. And say, and she sent you. All right, Dr. Tara.
So helpful. Thank you.
you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.